A rare and bold step in the ongoing battle over public health funding. I'm Cristina Howorun, and today 10 former health ministers penned a letter to current health minister Christine Elliott imploring her to reverse planned cuts to public health units all across the province. Cuts that, according to the City of Toronto, could cost Toronto Public Health $1 billion over the next decade.
The government's decision to cut provincial funding for public health, especially after municipal budgets based on the calendar year have been set, is adding not only insult, it's really adding insult to injury.
Helena Jassic was the last health minister under the previous Liberal government. The letter reads in part, "This cutting of public health services cannot go forward. It puts the prosperity of our communities and of our entire province at risk. Funding must be restored." The letter is signed by 10 former health ministers, primarily Liberals, but also 3 NDP ministers and Dennis Timbrell, who served as health minister under the Davis PC government, but who spent most of his more recent career in the healthcare sector.
We've heard that 83% of Ontarians in every corner of this province oppose these cuts, including 56% of progressive Conservative voters. A measles outbreak is not a partisan issue. Regulating clean drinking water is not a partisan issue. Vaccinations are not a partisan issue.
If you ask someone if you're in favor of cuts to public health, of course, I'm surprised that 100% of people didn't say so. But what we are doing is modernizing the system, making it more responsive to people's needs.
The Ford government recently notified municipal public health units that it will reduce its cost-sharing levels from 100% to 60 to 70% for some municipalities and 50% for Toronto. The plan also includes consolidating the number of public health units in Ontario from 35 to just 10.
The changes that we are making were actually the result of an expert panel that was convened by the previous Liberal government in 2017 after the Auditor General was critical of the current structure. So several of the signatories to the letter actually were supportive when they were in government of the changes that we are actually making.
That expert panel recommended amalgamating several public health units into 14 regional ones, but didn't recommend cutting funding to programs. Instead, it suggested, as part of implementation planning, the ministry will need to revisit funding constructs in order to implement the recommendations, namely the merging of several public health agencies.
I believe that the letter was sent very prematurely.
But Jassic, who also served as Chief Medical Officer of Health in York Region for 18 years, warned that the cuts could risk a repeat of the 2000 Walkerton tainted water crisis or Toronto's 2003 SARS outbreak.
Whenever public health has been cut in the past, tragedies have occurred. It is an absolutely vital linchpin in the system across this province for the health of Ontarians.
Putting panic into people that they don't need to be concerned about. We are going to make sure that those essential services are covered. To suggest that that's what's going to happen now with the changes that we make, I believe is irresponsible.